Thank you for joining us, everyone. We're just going to take a few minutes to let people filter into the Zoom, and we'll be beginning our program shortly. Good afternoon, everyone, and thank you for joining us today. My name is Catherine Semcer. I'm a research fellow with the Property and Environment Research Center, and I'll be the moderator of today's discussion. For those of you unfamiliar with the Property and Environment Research Center, or PERC as we like to call it, we're a research institute based in Bozeman, Montana in the United States, and we were founded in 1980 by a group of conservation-minded economists who wanted to find ways that markets and property rights could support positive environmental outcomes. We work on a wide range of issues, everything from the conservation of wildlife migration corridors in the American West to ecosystem conservation in Africa. And today we're going to be talking about how we might prevent the next pandemic and the intersection between pandemic disease, ecosystem health, and wildlife trade. It was a little less than a year ago that the first case of COVID-19 was identified. And roughly 10 months ago, the Chinese government reported a cluster of the disease in the city of Wuhan. Around that same time, the first laboratory confirmed case of the novel coronavirus was documented in the United States. We're a little over 7 months out from when the World Health Organization declared COVID-19 a global pandemic. As of today, the disease has killed more than 1 million people worldwide and made nearly 41 million people sick. It has infected people from all walks of life, from presidents to legislators to doctors, nurses, school teachers, and shopkeepers. It has forced military commanders to quarantine and small businesses to close. The impact on lives and livelihoods has been incalculable and immense. The International Monetary Fund estimates that the total loss to the global economy stemming from the COVID-19 pandemic may be $9 trillion or more. The state of affairs has people searching for both a vaccine as well as for answers. And it's our hope that today we can provide you with some of those answers. One thing we know for sure is that the COVID-19 pandemic has its origins in wildlife, and thus highlights the thin and often hashed line between our civilization and those parts of the world that we consider wild. Our relationship with wildlife and the ecosystems we share and depend on with it can inform our understanding of this pandemic and give us insights necessary to reduce the risk of future pandemics. To help us gain greater clarity on all of this, I'm pleased to be joined by two distinguished experts. Dr. Vanda-Felbab Brown is a senior fellow in the Center for Security, Strategy, and Technology in the Foreign Policy Program at Brookings. She is also the co-director of the Africa Security Initiative. Dr. Felbab Brown is an expert on international and internal conflicts and non-traditional security threats. She is the author of The Extinction Market, Wildlife Trafficking and How to Counter It, published by Hearst, as well as numerous Brookings publications, including Wildlife Trade in Mexico, Conservation, and Pandemics. Dr. Brown is a frequent commenter in US and international media and regularly testifies before the US Congress. She received her doctorate in political science from MIT and her bachelor's in government from Harvard University. Dr. Jonathan Epstein is the Vice President of Science and Outreach at the EcoHealth Alliance, a global environmental health nonprofit organization dedicated to protecting wildlife and the public from the emergence of disease. A veterinarian and disease ecologist, Dr. Epstein's research focuses on the ecology of emerging zoonotic viruses. The goal of his research is to better understand the factors that cause outbreaks and develop strategies that both prevent viral spillover and protect biodiversity. Dr. Epstein and the EcoHealth Alliance are working with a consortia of university and NGO partners under USAID's Emerging Pandemic Threats Predict 2 program, which is designed to establish an early warning system for zoonotic disease emergence. In 2004, Dr. Epstein was part of an international team of scientists that identified horseshoe bats as the natural wildlife reservoir for SARS coronavirus in China. Dr. Epstein's work has been published in journals including Science and the Proceedings of the National Academy of Sciences. He holds positions on 2 advisory committees in the International Union for the Conservation of Nature, and recently served as Chief Science Advisor for the Smithsonian's Institution's exhibit entitled Outbreaks, Epidemics in a Connected World. Dr. Epstein received his PhD in disease ecology from Kingston University, London, and his Doctor of Veterinary Medicine and Masters of Public Health from Tufts University. Thank you both for joining us today. Dr. Epstein, I'd like to start with you. And, we're in an election season, and there's a lot of information flowing around about COVID-19, who's to blame, how it started. Initially we heard reports that it began in a food market in Wuhan, China, but I've also seen evidence suggesting that that may not in fact be the case. Can you tell us, what is the current state of knowledge of how the COVID-19 pandemic emerged and got us to this point today?
Sure, and let me begin by thanking you, Catherine, for both organizing this conversation and inviting me to be part of it. I think it's a very timely discussion, and it's an honor to be here and to be next to Vanda on this panel. So thank you to PERC and Brookings. The reason that COVID-19 or SARS-CoV-2, which is the virus responsible for COVID-19, has been linked to wildlife trade is really twofold. First, as you mentioned, because the initial cluster of pneumonia cases that were identified back in late December of 2019 were associated with a large live animal market in Wuhan, China, a seafood market. But the other reason was because of the genetic relatedness of this virus to the original SARS coronavirus that emerged back in 2002, which has a lot of evidence for having emerged in a live animal market, a wildlife market in southern China, which then went on to spread regionally and globally to cause a pandemic. Now, the reason that this virus is related to SARS is genetic. It's about 20% difference, but within the family of viruses, coronaviruses, it is in the same group of viruses as SARS and related viruses. And in the time since SARS emerged, there's been a lot of research done, a lot of it from myself and colleagues at EcoHealth Alliance and other groups, really looking at coronaviruses in wildlife. And horseshoe bats are a reservoir for SARS and related coronaviruses, in fact, many different types of coronaviruses. The process by which SARS-CoV-2 emerged is still unknown. And so while we're very sure that this is originally a bat virus, because the closest known relative to the virus causing COVID-19 has been found in a horseshoe bat, the same kind of bat that also carries these SARS-related viruses. It's about 96 or 97% similar across its genome. However, how exactly SARS-CoV-2 emerged into human populations is actually still unclear. As you mentioned, that as there's been more epidemiologic evidence, more information coming out about early cases of COVID-19 in China, it turns out that some of the earliest known cases, which may in fact date back to November of 2019, had no association with live animal markets at all. And so the question still remains and remains to be investigated as to who the original cases were, the index cases, and how this virus made its way from wild bat populations into people. And it is probably true that wildlife trade to some degree has something to do with this emergence by sheer virtue of the fact that these bats are commonly hunted in China and eaten at local levels. They used to be brought into markets back when SARS originally emerged. That isn't as common in terms of large urban markets, but certainly in rural areas and local areas, there are still people hunting and consuming bats, and there's exposure to these bats. And in fact, we've seen evidence of communities who live around caves that have horseshoe bat populations in them have evidence for exposure to bat coronaviruses similar to SARS. They have antibodies against SARS-related coronaviruses. So we know that there is transmission that routinely happens between bat populations and people who have exposure to those bat populations. So most likely, although we still need to develop evidence to understand how SARS-CoV-2 emerged exactly, but most likely this is a virus that evolved in horseshoe bats and spilled over into people either directly or via other animal hosts, whether it's through the wildlife trade or through rural farming activities. And that still remains to be seen. So that's what we know so far, is that this is a bat virus that jumped into people, and exactly how that happened still needs to be understood.
You know, and you raise a good point about, you know, the possibility of it being transmitted by a livestock, you know, in addition to wildlife. And I think that's something that's been overlooked, you know, in this conversation. You know, while the original reservoir, as you note, is wildlife, it's very easy for these animals, these wildlife to transmit, you know, these viruses to domestic animals. And that kind of gets me to the next question that I wanted to ask you, which is, you know, it seems that conserving ecosystems, you know, is healthy ecosystems, intact ecosystems, is the first line of defense in preventing these types of viral spillovers. And, you know, part of that is because that, you know, when we see deforestation, when we see land clearing, it's very often for agriculture. And this, you know, creates a number of ripple effects, one of which is things like horseshoe bats come into contact with pigs. But can you talk a little bit, based on your experience, about how important it is that conserving intact, healthy ecosystems, especially in places like the tropics, is to pandemic prevention and to preventing, you know, the spillover of zoonotic diseases into the human population? And do you feel that, you know, ecosystem conservation is getting enough attention in policy circles?
I mean, it's important for people to understand that the single biggest reason that we're experiencing pandemics like COVID-19 and others that originate from animal populations, specifically wildlife populations, is because of human activities. Right? We are responsible for the majority of epidemics that are occurring around the world, particularly those that are zoonotic or of animal origin. And the number one reason, the number one driver, is land use change. You mentioned converting land to agricultural land, but any kind of alteration of the environment, anything we do to alter the environment around us that influences the way that we have contact with wildlife, either directly or via livestock that we also keep with us, can facilitate spillover, or the jumping of viruses or bacteria from their natural hosts, the wild animals that they have evolved to circulate in normally, into other species, whether are livestock species or directly into people. And there's a lot of things that factor into whether a virus may successfully jump and cause disease in people. But first, it needs a root. And that root is created when we bring ourselves into closer contact with wildlife. And that happens through activities like deforestation or agricultural expansion and intensification, and the wildlife trade. When we bring wild animals out of a forest environment, out of an intact ecosystem, into an unnatural setting like an urban market where different species are mixed together and have opportunity to trade pathogens, and then have those pathogens have the opportunity to jump into people. So ecosystem integrity, by that very virtue, is essential to limiting our risk for spillover and outbreaks and pandemics. Because if we keep our ecosystems intact, the reservoirs that live within them that are carrying pathogens will stay there. The viruses that are circulating, whether it's in bats or rodents, primates, or other wildlife, will remain circulating in the communities of animals that they have evolved in, and that's fine. So it's really when we introduce ourselves to those environments. Now, typically and historically, Biodiversity conservation, well, it's gotten a lot of attention for the very good and noble reason of protecting biodiversity. We depend on biodiversity and intact ecosystems for lots of reasons. But now our health is another factor, understanding that as we degrade ecosystems, our health is at risk. And COVID is an example of that, and there are many others. Ebola has been associated with deforestation. Other emerging viruses have been associated with agricultural expansion. You mentioned bats and pigs coming into contact. Well, just recently in China, there was a major outbreak on pig farms of a severe diarrheal disease. It wasn't zoonotic in that this virus hasn't jumped into people that we know of, but it caused the death of hundreds of thousands or millions of pigs, and it came from the same bats that carry SARS and SARS-CoV-2 coronaviruses. In fact, it was another coronavirus that made its way into pigs. So as we promote contact between wildlife and livestock and wildlife and people, we are putting our own health at risk and really the health of the planet. So I don't think that wildlife or ecosystem conservation is getting enough attention yet, but I'm certainly seeing the conversation happening at high levels with intergovernmental organizations, international organizations, and at government levels, recognizing that human health and the economy is at stake when it comes to deforestation and land use change.
No, and I would agree with you. You know, it's starting to get increased attention. I don't know if you saw the report that came out from the consulting firm McKinsey & Company last month. It was titled Valuing Nature Conservation, a methodology for quantifying the benefits of protecting the planet's natural capital. And, you know, one of the things it talks about is establishing conservation areas, specifically because of the public health benefits of doing so. But what it found, and I'm not sure if this conforms with your research, but I'm using my notes here, 1/2 of the global risk of zoonotic disease transmission is currently concentrated outside of established protected areas. And they also found that conservation areas prioritized currently have a 10 to 80% higher risk of contributing to viral spillover if action isn't taken. My own research has, you know, sort of shown, and I want to chat with you a little bit about this, Vanda, because I know we've chatted about it in other forums. You know, there's a lot of policy obstacles to conserving, you know, tropical forests and other critical ecosystems. One of them is secure land tenure. You know, I reflect, there was a report that I think came out in 2016 from USAID on the lack of security of land tenure in places like Africa, in places like Southeast Asia, in places like, you know, South America. And, you know, we're faced with this situation that people can only get secure land rights if they clear these forests. So there's really, you know, this massive economic disincentive, you know, to keep these forests standing. And Vanda, I know you've done a fair bit of work, you know, looking at like what are some of the, aspects of policy aspects of ecosystem conservation. And I was wondering if you could comment a little bit on some of what your research has revealed. You're muted, Vanda.
Thanks. It's wonderful to be here with you, and also great to have the conversation with John. And I'm thrilled that we are talking about ecosystem conservation and habitat conservation as a critical part of the narrative. Because while I'll agree with both of you that the conversation is emerging, I don't think that it has become sufficiently widespread in policy communities. And in fact, what we are seeing in various parts of the world, really around the world, is very significantly intensified pressure on natural habitats, as well as, for that matter, wildlife, as a result and after COVID. With the pandemic decimating government budgets, often decimating budgets for law enforcement, for rangers, for other forms of law enforcement, and making governments desperate for any kind of income. So extractive industries or agricultural industries have become even more powerful voices in persuading governments to allow changes to habitats, to allow clearing of land, to allow logging, to permit agricultural activities, whether this is African oil palm cultivation or whether it's clearing of land for ranching. So we have seen massive changes in environmental regulations in Indonesia. Very interestingly, we have also seen significant public pressure and discontent with the new legislation that has come to pass in Indonesia, but nonetheless weakening of environmental protection, really expanding of habitat, pressures on habitat, and we're seeing the same intensified deforestations, including through fires in places like Brazil, Bolivia, as well as parts of Africa. There are multiple dimensions why this is happening. The desperation of governments to generate economic revenue is one important element here. And of course, that's deeply counterproductive because the way out of COVID that many governments are adopting is just going to intensify and speed up the arrival of the next viral spillover and potentially the next epidemic and pandemic that John was talking about. I also want to highlight here that a lot of the international system is set up to expect the emergence to take place in East Asia. But it's not always the case. The swine flu H1N1, of course, originated in North America. And there is significant potential that we will see a viral spillover taking place in Latin America that has been decimated by COVID, both in terms of death rates, levels of infections, and economic contraction of about 9% for the region, really very catastrophic economic contraction. Yet, whatever level of awareness there is in Asia and some actions that have been taken place in places like China are really not taking place in Latin America. This conversation is simply not there about the need to protect habitats and to be aware of wildlife trade, both to smarten up the legal elements of wildlife, but also to crack down on the significant levels of poaching and illegal wildlife trade taking place there. So I actually remain concerned that the tragedy of the pandemic that has wiped out 25 years of anti-poverty efforts in 25 weeks, in less than 25 weeks, that will so far have pushed about 200 million people into poverty, that has already caused the devastation that many a regional war would simply not be capable of causing, is not being adequately used to push for much smarter conservation policy, much more enhanced and intensified conservation policies.
Yeah, if I can add to that, because I think you're really making strong points about the economic incentives and the pressures that will exist post-COVID to restart economies. And a lot of that pressure is going to be directed towards natural systems and probably exploitation to try to, especially economies that are based on that. We started to look at the economic damages that are associated with clearing land this was in Malaysia. We were working with the government of Malaysia, which is particularly active in oil palm agriculture, as well as other industries, but also working with private sector and industries, because I think recognizing that they have to be an essential part of any solution, the private sector and the global conglomerates that are driving a lot of the land use change. And we started to model the fact that if you clear certain areas of land that are high in biodiversity, which would be rich conservation areas, it could present a higher risk for epidemic emergence, or zoonotic pathogen emergence, by virtue of the fact there are so many different potential reservoirs from zoonotic pathogens. And so the damages, should that cause an outbreak, are actually very high in terms of monetary degree, millions of dollars that could be a burden on public health systems, cessation of work, burden on an industry. And so interestingly, the government has been quite receptive to this approach and understanding that maybe if this area of land were developed and not that area of land, because the risk is lower and the potential damages could be lower, that it could be a win for conservation and also an economic win by avoiding damages that could result from clearing land that leads to an epidemic. And so that's just an example of an approach that might be used to start to look at bottom line economics as an incentive for protecting ecosystems.
Which is fundamental. And, Catherine, that's also part of the conversation that you started. And I think, John, it was you who mentioned the need to price biodiversity and price it both to give stakes, economic stakes for conservation to communities, to local communities that live next to high biodiversity areas, but more broadly to industries and to governments. And that has often been elusive. What there has been some progress is, of course, pricing carbon capture, whether it's REDD+ mechanisms and the opportunities they bring and the challenges and deficiencies that still deeply exist in these markets. But it is not an adequate pricing mechanism. You can capture carbon by having eucalyptus plantations after natural habitat has been cleared off and massive biodiversity losses. So where the economics and innovative economic thinking really needs to move is to price biodiversity, and particularly price intact or close to intact habitats and biodiversity habitats much higher than other habitats, either degraded ones, that might then be more viable places for other forms of use, because we are not going to move away from people using nature and using wildlife. That's just not going to happen. The question is, however, how we both balance the need to clearly change the way we live, whether it's the enormous food footprint that we have right now, way beyond what the planet can bear. I understand about 5 times, the current estimates are 5 times the carrying capacity of the planet, the way we produce food, or whether it's the clearing and destruction of habitats and utilization of wildlife. At the same time, we would be foolish if we simply wanted to set up just an antagonistic relationship between economies and conservation that would likely result in conservation losing and ultimately catastrophic economic outcomes as well.
No, all valid points. And, you know, I come back to that International Monetary Fund number that, you know, COVID is anticipated to create $9 trillion in losses. And this isn't even the worst of what's potentially out there. You know, I think you would agree, you know, with me, Jonathan, on that there's potentially far deadlier diseases awaiting us in some of these areas. And I don't know if you saw the paper that was done by Andy Bowson at Princeton, you know, along with some co-authors, but they estimated that it would cost about $30 billion a year, you know, in investment to conserve the areas where we're most likely to see viral spillover occur and to have a proper degree of pandemic prevention. You know, it seems to me that, you know, when we start bringing in not just like the local landowners, but also the multinationals and some of the other players in the sphere, that number becomes a lot more doable. And, you know, it's something that deserves further discussion. You know, in terms of the economic pressures that governments are facing, you know, debt seems to be a big one, particularly in Africa. You know, we've just seen Zambia, you know, facing a debt crisis, and you know, lenders seem very unwilling to forgive these debts that many of these emerging markets where we have these hotspots of zoonotic diseases occurring. You know, do you see the potential for debt for nature swaps to maybe help facilitate some of this ecosystem conservation that's necessary? I mean, I know the Nature Conservancy has pioneered that in the Seychelles to protect resources of the blue economy, but can debt for nature swaps be utilized in your view to conserve tropical forests and other ecosystems to safeguard public health?
Is the question to John?
Either one of you can take it.
Vanda, do you want to start?
Sure. I think that's a very important line of thinking and inquiry. And I would highly endorse such approaches. I would cap it, however, with the need for diligent monitoring and conditionality, that in fact we avoid situations where the money is released and destruction takes place subsequently. So phase out in how that is reused on conditionality, and that we avoid some of the big problems that we see, for example, with the release of money for REDD+ systems. So yes, I'm all for it, but as always, the devil and the angel are in the details, and thinking about phasing, monitoring, and actions so that we avoid situation of take the money and run and still cause nature destruction subsequently would be very important.
Yeah, I agree. The key to any kind of incentives or behavior change is to make sure that there's equal carrot and stick, that you have policy and enforcement that goes along with incentivizing so that people are, given incentives to do the right thing, whether it's protect land or whether it's, reduce the extraction of animals and resources from land that is high risk because it's high biodiversity. But also there needs to be investments in enforcement, and also governments willing to set policy that protects those lands. And so that's always the challenge with any of these issues.
All things that policymakers need to start thinking about today, it seems like. I do want to move into the topic of wildlife trade, since that has been so prominent in the discussion around COVID-19. We've seen a lot of proposals emerge in the months past, that we need to just have blanket bans on wildlife trade. Everything from the consumption of bushmeat to banning the importation of hunting trophies from Africa. Is that a realistic and effective strategy? And Vanda, I'll put that question to you first, since you wrote the book on wildlife trade. Are these calls for a blanket ban, the way to go, or do we need a more surgical, targeted approach, a smart approach to wildlife trade as opposed to a blanket approach?
So in general, I'm not a fan of blanket bans. In many areas of regulation, I think that it introduces significant problems. That said, there are very good reasons to keep certain activities or certain places illegal. And while all my inclinations are toward, how you phrase it, surgical bans, I also recognize that they come with challenges. They introduce law enforcement difficulties, and they introduce ambiguity and difficulties in reducing demand, which is really fundamental to all the conversation that we're having. We need to both reduce demand for wildlife, and we need to reshape demand for nature products toward much more sustainability. Frankly, we need to reshape demand for legal for agricultural uses, whether it's soybean that's cultivated as a result of deforestation of tropical forests, or whether it's beef. So I think there are many changes, and really significant work needs to be done on changing our consumption patterns, our demand proclivities, and our consumption patterns. So with all that preface, a general blanket ban on wildlife trade, in my view, would be deeply counterproductive, both to conservation and biodiversity preservation, as well as to preventing another pandemic. Why do I say that? Well, as I mentioned, a lot of conservation is ultimately based around having all kinds of stakeholders, from local communities to powerful industries and vested interests to governments, believe they have an economic stake in conservation. It goes back to the debate that we started of setting up conservation as being merely and fully antagonistic to economics is a prescription for loss for conservation, for a defeat of conservation. So any kind of economic opportunity there is to harmonize and synchronize economic incentives with conservation is important. That also means that some wildlife trade will inevitably need to stay. And here we then need to think about what are the most dangerous elements of the trade with respect to pathogen transmission, virus spillover, and pandemics. What are the most dangerous areas, or what are the most dangerous sources of transmission? We spoke about some of them. I do believe, for example, that we should see bans on commercial wildlife markets with unhygienic conditions. Many of the wildlife markets that exist in East Asia, but are also proliferating in parts of West Africa or Latin America, mix many species together in catastrophically unhygienic and outright cruel conditions, with hundreds of specimens of a bird or reptiles packed together in one cage, another cage on top of that, packed with another taxa of animals, all exposed to sun with poor food, poor water conditions, often animals dying right inside the cages, rotting there, and just enormous incubators for viral spillovers. Those markets should not exist. Nonetheless, there are other elements of wildlife trade, such as trade in furs or curios, that does not pose the same risk of transmission during the trade. Now, anytime there is hunting, and John, I hope you can come in here, anytime there is extensive offtake from the wild, the handling of animals live, or even the ones that are killed, generates chance of wildlife pathogen transmission to humans, or the transmission of pathogen from one taxa of animals to another taxa of animals, which is something else we need to think about. John, you started that conversation with the mortality of pigs, certainly the H1N1. It's also about not spreading disease to livestock and not spreading disease to wild animals that are native to our countries, to particular localities. So there will need to be parsing, and certainly not one blanket ban. Any kind of wildlife that keeps ecosystem standing, that even ideally allows for reverting converted land back to ecosystems, whether it's hunting of antelopes, perhaps for food, as long as they are slaughtered and processed in ways that prevent pathogen transmission, where there is significant control, or trophies, is important. That said, that also doesn't mean that all wildlife trade as it exists currently should be allowed to happen. Then we will simply see the emergence of one pandemic, one viral spillover after another, and many of the existing wildlife markets are just catastrophically dangerous. My final comment here is that in general, I don't believe we should support the expansion of demand for wildlife. So there is a lot of emergence of new wildlife markets, as I mentioned, in Latin America, in West Africa. That's not subsistence hunting. That's not subsistence food. That's either luxury wild meat or hunting for East Asian markets, or for that matter, for newly affluent Africans or newly African Latin Americans, with Latin American chefs promoting meat dishes made out of anaconda and caiman. There is absolutely no need to encourage that, and I would in fact suggest there is strong need to discourage that.
Yeah, they can have the pythons from Florida that we have overpopulating if they want to serve those.
Exactly.
Now, look, the only thing I would add, I mean, it's a terrific summary of the issues, and I absolutely agree. I don't think a blanket ban is something that would be effective. We know that outright bans on illicit behavior typically can just drive it underground, and I think that's the risk here, is that if you just simply make wildlife trade illegal across the board and wildlife markets illegal, people will continue to hunt, capture, and trade wildlife illegally, which makes it all that much harder to monitor from both a conservation and a public health standpoint. So you have to have a careful balance of considered legislation. There does have to be legislation that makes certain things illegal, like these large wildlife markets that would bring different species together in unhygienic conditions, certainly. But you also have to really make efforts to work on the ground with local experts, social scientists, anthropologists, folks who understand the population and the communities, if you're really going to enact behavior change, reduce demand for wildlife. That's the other part of the equation, is limit the supply but reduce demand, and really figure out what is driving people to consume wildlife. Is it prestige? Is it subsistence? Is it a luxury? And I think of the wildlife trade, which is such a massive global industry, as really having two parts. One is the subsistence hunting of wildlife, communities that depend on wild animals as a sole source of protein or an important source of protein, or of livelihood. And that is really hard to just legislate away, especially without an alternative. But then there is the element of the wildlife trade, which I think also fuels the whole illegal wildlife trade, which is a multi-billion-dollar global industry, which is that of luxury. People wanting exotic animals for pets, ornaments, wildlife meat, consumption, wildlife parts, as you were mentioning, Vanda, for exotic meals. And these tend to be people with means, affluence, power, who want to consume wildlife. And that is what really has to be focused on in terms of enforcement and restriction. And the problem with, as you say, surgical restrictions, where perhaps you're limiting one kind of trade and not another, is that the wildlife trade is totally intertwined, where you have people that might be trading ivory, which in and of itself might not pose a pathogen risk, but it is covering other animals that are being shipped with it, or perhaps legal trade of, say, seafood on the surface, and then illegal species being covered up underneath in the same trade routes. And so there's a mixture of legal and illegal that makes it really difficult to disentangle, stopping one part of the trade and not another. So again, it has to be demand reduction with legislation. And I think that's always going to be a big challenge. But there's a parallel to be drawn here. When you mentioned the sort of opposition of economy and conservation, we're seeing the same thing happen at least here in the United States with economy and health, where it's a false dichotomy, but people are pitting against one another, shutting down the economy as a necessary means to stop the pandemic, which is going to cause economic devastation. But in fact, controlling the virus and the pandemic is the key to a successful reopening of the economy. And so they're not really at odds, but need to work together. Public health is not the opposite of economic growth and freedom. And so the same can be said with conservation. I think there's a way to protect biodiversity and restrict and eliminate illegal wildlife trade while still allowing for local livelihoods to prosper. And that's what we need to work on.
Yeah, and it seems to me too, there's also, a cost benefit analysis that has to be done. A lot of my research focuses on the safari hunting industry in Africa. And, when I look at that industry, I see an industry that conserves 344 million acres of intact ecosystems, which is about 20% more than the continent's national park system. I also see an industry that's, directly responsible for the funding of counter wildlife trafficking initiatives in countries like Tanzania. Their entire anti-poaching program is predicated on the dollars that come in from the safari hunting industry. So it's a question of, isn't this providing more of a benefit, to pandemic prevention than, banning hunting trophies, which haven't been shown to present a disease risk, would. And so, it's definitely a question, it seems to me, of establishing this balance, between cost and benefit, in relation to wildlife trade. We talked about.
If I can just intersect here, Catherine, I think that's exactly right. And I would also couple it with what is, I think, very difficult for our policy and particularly many in the conservation community is that this balance need to also be coupled with constant review and policy flexibility.
Yeah.
Because what is characteristic of many of the conservation efforts, and particularly as linked to dealing with poaching and illegal wildlife trade, is that their success is in fact enormously varied. A particular line of policy might work well in an area, but really not work in another one. And what it really means is that effectiveness is enormously contingent on local cultural setting, local institutional settings, and in this case, also particular biological characteristics of species and ecosystems. And so getting policy right is much harder than getting policy wrong. And experimentation is inevitable. There needs to be experimentation because one shoe does not fit all. But that experimentation needs to come in with a willingness to review and say, okay, permitting this legal farming worked fantastically well and really took pressure off wild trade. The cayman from the farm really supplied this demand, brought local communities, and the ecosystem is standing fantastic. As opposed to farm Y, 20 kilometers away, where the farm merely serves laundering mechanisms, and that farm needs to be shut down. But it's this level of nuanced, detailed monitoring, willingness to police both legal markets and illegal ones, but also the legal element of the trade, where policy will be successful. And just as blanket bans will be ineffective, any other blanket policy comes with enormous risks and is likely to generate a lot of problems.
Mm-hmm. We've been talking a lot about South America, Africa, Asia, but this isn't a problem that's endemic to those areas. I mean, it's also here in the United States. There was just a story in the New York Times about a flying squirrel smuggling ring here in the United States. And Jonathan, I wanted to get your thoughts on that story. I know you read it. If you could talk a little bit about what the situation was and why it's something to be concerned about as an aspect of, illegal wildlife trade.
Yeah, this really speaks to a specific part of the wildlife trade that has to do with the pet trade. And the pet trade, has both legal and illegal components. Legally, animals are traded, exotic animals are traded and sold around the world with permit and with some oversight from conventions like CITES that monitor the movement, import, and export of endangered species and to try to prevent that from happening. But there's a huge demand for exotic pets. And the pet trade has been linked to introduction and outbreaks of zoonotic disease. For example, back in 2004 in the United States, there was an outbreak of monkeypox virus in the Midwest. And that occurred because of the importation of pouched rats from West Africa, Gambian pouched rats, into the United States as part of the pet trade. It was totally legal, it was permissible. These rodents were brought in, they were brought into a clearinghouse, I believe in Texas, where they intermingled with other rodents, including prairie dogs and North American rodents. And then the animals were distributed out to different pet shops and swap meets and conventions, where animals were traded. And the pouched rats are a reservoir for monkeypox virus, which can cause pretty significant disease, particularly in children. It's a pox virus, so it causes skin lesions, but it's fatal in about 10% of cases, pediatric cases. And so this reservoir for disease that was brought in, the rodents infected prairie dogs and other rodents that were disseminated out through the Midwest. And there ended up being about 70 cases of monkeypox, a disease we don't have here in the United States, that occurred. And the CDC investigated it, and it stems to contact with prairie dogs and other rodents. And so after that, the CDC instituted a policy that banned the importation of African rodents for the specific reason that they could be reservoirs for disease. The challenge there is that at a policy level, that's an appropriate legislation, knowing that rodents from West Africa might carry monkeypox, but it was specific to that region. So what would the pet industry do? Well, it would start importing rodents from South America, which would still be legal under that context because there hadn't yet been a proven case. So that just highlights a policy gap in terms of import-export. But that was bringing rodents in. Now, the article you're talking about, the recent case, was that there were about 3,000 flying squirrels, southern flying squirrels, which are native to the United States, particularly Florida and Georgia, the southeastern region, had been harvested over the past 2 years for export to China, also as part of the pet trade. So it isn't just bringing exotic animals into the United States, but we're sending out our wildlife illegally. These are protected species that were being illegally captured and laundered through, I believe, businesses in Atlanta and maybe in Detroit, and to the tune of millions of dollars in terms of revenue for the smugglers. And flying squirrels are a reservoir for scrub typhus. That's caused by a zoonotic bacteria that can also be fatal in people. So another example of how we might be exporting a disease reservoir to other countries that could lead to human illness and death. And so the pet trade can certainly be a driver of disease emergence, and we need to focus on that and think about that as a risk and really limit particularly the illegal pet trade as a means to protect health.
John, if I can ask you here, it is my sense that the legal trade, even in the US, is really inadequately monitored for disease transmission, that many animals are imported into the country, and if they are perhaps a rhino, a highly valuable animal, there will be significant health inspection. But for very many other animals coming in, from reptiles and amphibians to, as you mentioned, even mammals like rodents, the inspections are really very limited to non-existent. And it seems to be a major problem. And if it's so weak here, it's very likely that it will be even weaker in very many other parts of the world.
Absolutely. If you want to look at our vulnerability in the United States from a disease introduction standpoint, we have virtually no ability to screen animals that are imported through the legal pet trade, let alone those that are smuggled in. We have no ability to screen them for pathogens that could threaten livestock or human health. Now, we do have, the U.S. Fish and Wildlife Service does have a mandate and resources to protect against the importation of endangered and endangered species, or those that could be a threat to our ecosystems. An example being Burmese pythons that have been released in the Florida Everglades, which are causing devastation there. Those slip through as pets and then they get released and it's a problem. But the Fish and Wildlife Service does not currently have a mandate nor the resources or expertise to screen incoming wildlife for disease. And so animals can get imported. It's basically up to the importer of record to quarantine animals before introducing them to their stock. But if they're going into the pet supply, there isn't a lot of monitoring for potential disease. And so it's an undue burden on, I think, consumers, but it's also a real risk to the country in terms of allowing potential reservoirs for disease to be brought in through the illegal pet trade.
We only have a few minutes left, and I wanted to move to audience question and answer, if that's okay with you. Our first question is, how do you measure the risk of zoonotic disease? Are there good measures to determine the best areas for conservation to reduce the risk of spillover?
Yeah, I can answer this. We do have a very good sense of which parts of the world are particularly vulnerable to zoonotic disease emergence, so-called EID hotspots. We did an analysis, a global analysis, looking at factors like biodiversity, wildlife biodiversity, human demography, livestock populations, dynamic changes such as land use change, and things like latitude, which link to climate, and did a predictive analysis. And there are certain parts of the world that light up as hotspots, and they're not exclusively in the tropics, but as you'd imagine, many of them are. They tend to be high biodiverse areas where there's a lot of land use change going on and where people and livestock have a high degree of likelihood of coming into contact with wildlife. And so that allows us to focus limited resources on a global level to looking at interfaces, specific areas in these countries where people and animals have a lot of contact, where we think that there's the highest likelihood of spillover occurring.
Excellent. Ben, I had a question for you. In the wake of the COVID-19 pandemic, I'm trying to summarize here. There was a lot of focus on China and how it was responding to the issue of wildlife trade. And, we've seen everything from, the UN highlighting that China is still the largest global consumer of pangolins, which present a high degree of disease transmission risk. We've also seen a recent report from the EIA saying that since the COVID-19 pandemic began, EIA is the Environmental Investigation Agency, that consumption of pangolin has not really decreased. What is your assessment of how the global community is reacting to the illegal wildlife trade in the wake of the COVID-19 pandemic? I mean, can the global community be doing more to address these networks that engage in illegal trade?
Well, absolutely. I think that there are many opportunities to do more. And I would say in this case, doing more also needs to come coupled with doing better and smarter. So we can have a whole separate long conversation about what are the most effective pressure points, law enforcement strategies for dealing with wildlife trafficking and poaching. I would just highlight here that dismantling retail markets is very important. Even if the retail markets move online, and go underground and are clandestine, the less visible, the less damage they cause. And we know that from very many other markets that have both legal phase and illegal phase or are purely illegal. So anything that can be done on dismantling demand markets is very important. China has moved in some very important way. There is a ban on animal meat consumption. China is apparently wild animal meat consumption, that is. China is apparently moving out to phase out wildlife farms, at least those that are geared toward animal consumption. I think that's very important. I am very concerned, and one area that we haven't talked about is traditional Chinese medicine, something that the Chinese government is very strongly committed to and has been very aggressively promoting around the world. We have both seen the government promoting medicines such as including those of bear bile as treatment for COVID without, in fact, any kind of scientific evidence that there is any effectiveness for treating COVID. We have also seen the government of China and Chinese companies exporting TCM as a treat to COVID to highly vulnerable countries such as Afghanistan and Pakistan. something that I find very distressing because you have countries that already have essentially non-existent or very weak healthcare systems, and on top of that, to be given medicine of questionable or unproven effectiveness is particularly cruel, especially when it's sold and the countries have to pay for it. We also haven't seen any movement with respect to wildlife trade and trafficking in places like Indonesia, a place of immense risk and danger in terms of zoonotic disease emergence and biodiversity losses. So there are very many dimensions to where a lot of improvement needs to take place, some important steps, important actions by the Chinese government, and still very many deficiencies in my view, and very difficult area, but very important area to think about, which is traditional Chinese medicine. A lot of which is not about animals. Lots of traditional Chinese medicine is about plants. They can also be endangered, and their extraction can also undermine biodiversity and put people close to pathogen. But particularly the animal aspect of that is problematic. And distressingly, some of the Chinese wildlife farms are apparently now being encouraged to shift to TCM, perhaps with the very same animals that were being phased out, such as civets, for meat consumption. Not, in my view, a productive and healthy way to go.
Thank you. One last question. We have a doctor in the audience, and she was wondering, what can healthcare providers do to prevent the next pandemic? What discussions should they be having with their patients about how their individual behavior could help prevent the next pandemic? And are there any other actions that healthcare providers should take?
Well, that's a great question. And I think that you can think about two parts to the pandemic. One is, what can individuals and consumers do to reduce the risk of pandemic emergence, the risk of this even happening again? And that's really us being aware of what products we're consuming, what the downstream consequences are in terms of conservation, whether those products are derived from activities that promote environmental damage or ecosystem destruction. And so that's consumer awareness, right? That's probably the most power we have, particularly in the United States, is consumer awareness and choosing to buy and use products that are not damaging. The second thing, though, really is our personal responsibility to reduce transmission of disease should there be an outbreak. And I think right now is a perfect time to talk about our own actions in limiting the spread of COVID-19. And that is that when we know that there's an infectious disease that has emerged and an outbreak going on, that it is within our power to limit transmission of that disease and following public health guidelines. In this case, wearing masks, social distancing, hand washing, and just being very aware of not going into crowds or places where people are congregating. Those are things that we have a lot of control over. And as a physician, things that you can talk to patients about in terms of limiting their risk, particularly when it's in the context of perhaps underlying conditions or pre-existing conditions they may have that put them at greater risk for contracting an infectious disease. So those are some things that we can do as healthcare providers and also as individuals.
If I can just add one thing to highlight the first element of John's answer, which is what can we do to prevent pandemic as individual consumers? I mean, what we have historically seen in conservation is that often most significant change, both legislative enforcement, but also in consumer behavior, came when conservation was linked to preventing diseases. For example, ozone legislation followed the emergence of skin cancers and other significant health impacts. Acid rain and its impact on health people was critical for launching all kinds of crucial environmental regulations. Humans are selfish as species, and they react most to preserving other species when preserving other species means also preserving them. And so there is an enormous opportunity in the immense tragedy and devastation of COVID of again highlighting how our health is linked to the good health of biodiversity of the planet. And that's a message that needs to be sent, that every choice that we make, by local, by sustainable, Don't buy exotic pets. There is no need for people to be keeping monkeys in their houses, or for their relatives in faraway places to be eating salamanders or shark fin. There's all kinds of choices that we as consumers can make and must make. And one of my big fears is that as the COVID pandemic wanes off, if there is a vaccine, or even in the absence of vaccine, that 3-4 years down the road, we'll have a repeat of memories waning, like after SARS, and our behavior resorting to all the same devastating practices and behavioral choices that will just speed up the arrival of the next pandemic that could be even far worse than the current one. And we need to avoid that. And there are many ways to do it, one of which is systematic, unwavering and sustained effort to change our consumer patterns and to change how we relate to nature. And that messaging will need to live not a year from now, but 5 years from now for it to be effective.
Yeah, it makes me think about when I was in high school, and there was a lot of peer pressure. If you were caught in the high school cafeteria with a styrofoam container, you were shunned. And eventually nobody was using styrofoam anymore. So that's definitely important. With that, I would like to thank you both for sharing your knowledge and your expertise with myself and with everyone who joined us today. I've got a couple takeaways, from this conversation. The first is that ecosystem conservation is absolutely critical to public health, and that to get ecosystem conservation to the scale that's necessary, we need to get the economic incentives right, and take some of the economic pressures to degrade ecosystems away. The second is that blanket bans on wildlife trade are not likely to work, and that we need to pursue a smart approach to trade, or else we're possibly making the situation worse for ourselves and walking headfirst into another pandemic. Thank you very much again for joining us today and for sharing your knowledge and expertise. And thank you everyone for joining us. If you're looking for more information on PERC, you can visit us at perc.org or at PERC Tweets on Twitter. And EcoHealth Alliance and Brookings are also on the web and on Twitter. I encourage you to visit both of their websites and their Twitter feeds for additional information on this and other important topics. Thank you, everyone.
Thank you, Catherine.
My pleasure.